Okay, today we are going to talk about the exam or the objective in the SOAP note format, keeping in mind that SOAP stands for Subjective, Objective, Assessment, and Plan. Within the exam, there are two guidelines that we use, or that we have to use. One is the 95 that was created in 1995. The other is 97, which was created in 1997. Clever naming schemes, I know. When do you use them? Well, you, according to Medicare, can use whatever is the most beneficial to the physician at the time of the visit, which means that if I come in to see a physician, or say a patient comes in to see me, and for that particular note, the 95 guidelines are more beneficial to me, and then they come in the next day and the 97 guidelines are more beneficial to me, then I get to use the 95 for the first day and the 97 for the second day. And that's not typically what we do. The reason is because for most charts you want the HPI and the medical decision making to drive the code. That's the subjective and the assessment and plan. You don't want the exam playing a huge part in the code, so if you continually try to use codes or to evaluate exams higher, and you're getting higher codes based on your HPI and exam, it will make an auditor scratch their heads, and they will start asking a whole bunch of questions which you will not really want to get involved in. So I generally stick to one set or the other, and then sometimes I'll use, I usually use the 95, but then I'll use the 97 to kind of back up what I feel about the 95. There is one caveat to all this. The guidelines that Medicare put out in 95 and 97 were complete sets. They weren't just about the exam. It's just that there were two big differences between the guidelines. One was the exam, and that's the biggest difference, but the other is the introduction of this 3C note, which was part of the 97 guidelines. So remember that a 3C note is 3 chronic illnesses, where you can list out then each illness and then give how the patient is compliant with that treatment plan that you've set up for him. In that case, you don't have to use the descriptors. If you elect to use the 3C note in evaluating a progress note, you have to use the 97 to do the exam, because the 3C did not exist in 1995 guidelines, so ergo you have to use 97. We're going to go through the 95 guidelines first, kind of go over some terminology, and then kind of see a major pitfall of the 95 guidelines. And then I'll show you the 97 guidelines. In both the textbooks that we've had and all the other ones that I've looked at, they don't teach you the 97 guidelines, which is interesting to me because Medicare prefers the 97 guidelines. They allow you to use either one, but they really do prefer the 97 guidelines. I think you'll see why from an insurance point of view, but more on that later. For now, we're going to stick with the 95 guidelines. I'll show you those, and then you can see the 97 and make your own decisions. So for the 95 guidelines, there's two main concepts that you need to know. You need to know the difference between an organ system, and you need to know the difference between a body area. Okay, organ system is basically just laid out. It's nice that the organ system actually follows the same format, more or less, as the review of systems. So this table that I've highlighted is the one that we will use for review of systems and also for organ systems. The only exception is these last two that I have in asterisks by the side, or at the beginning. Those two are combined into a single organ system. Okay? As much as possible, you want to stick with organ systems. We'll see that in some of the examples. Let me go through a couple of examples of what you would see in an organ system. So constitutional would be vital signs, general appearance. Eyes would be looking at the pupils, the sclera, the conjunctiva, lids, fundi, optical discs. Ear, nose, mouth, throat is basically anytime they stick the otoscope in your ears or use it to shine a light up your nose or down your throat. Cardiovascular usually is them listening to your heart. Sometimes they'll do what's called percussing the heart, but usually that's very explicitly laid out. Respiratory can be listening to the heart usually, but also any notes about respiratory effort. Gastrointestinal is if they're listening for bowel sounds or checking for what's called organomegaly, which is an enlarged spleen or an enlarged liver. Sometimes they'll call both of those out, and they'll call them, they'll say no hepatomegaly or no splenomegaly. And then the other thing that they'll look for is masses or hernias in the abdominal wall. Genitourinary is any exam having basically to do with the pelvis or genitals. Musculoskeletal is joints or muscles. Pain is usually associated with musculoskeletal. It's not part of a neurological exam. Skin and or breast is usually looking for rashes, lesions, things like that. Breasts, nipple discharge or a mass, nodules, that sort of thing. Neurological is like cranial nerves. Looking at reflexes, you'll see something called alert and oriented. You could also see something about gait and station, which is in a different place for the 97 guidelines, but that's typically where you'll see it is under neurological from a medical point of view. Psychiatric is usually mood and affect, judgment and insight. Memory is another one. Endocrine I don't see too much, but that would be anything having to do with hormonal imbalances or diabetes. And then hematological, lymphatic, allergic, and immunological. Most of that's going to be under lymphatic is where I typically see it. They'll say, no lymphadenopathy in the cervical region or in, particular lymph nodes that they're looking at. So it's kind of an example of some organ systems. What I want to do is show you now what a body area is and kind of go over the difference, because you may kind of look at it, especially with a couple of them, and say, well, I don't understand what the difference is. So the body areas are listed down here. We've got the head and or face, the neck, the chest, which is not listening to the lungs. The chest is just looking at kind of the outer chest wall. The abdomen, which is not the gastrointestinal. Typically the abdomen, they'll say, they have an obese stomach, or there's no tenderness, so it tends to be very external. Genitals, groin, buttocks is kind of the same thing. Back is usually not looking at the spine. I usually classify in here something called CVA tenderness. CVA is short for costovertebral angle, which if you imagine going down the line of your rib cage, across your waist and up your spine, that's about where your kidney is. And if you're having any sort of kidney dysfunction, usually it will be a little tender back there. So I usually put that as back because they're actually touching the back. They're not really doing it. You could consider it part of the genitourinary exam. Again, it's interpretation. But I usually stick it in back. And then extremities. Extremities are usually always called out. Usually they'll look for edema, or they'll look for what they call peripheral pulses, which could be the femoral arteries and or the pedal pulses. One thing to keep in mind, though, is that for the most part you're going to be sighting on the side of the organ systems when you look at a note. So let's go ahead and go through an example and kind of show you what could not be. So the first thing that we've got here under the objective is a whole bunch of vital signs, and we've got general appearance. Those are both called part of constitutional. And then skin is good turgor, no rash. Turgor, by the way, is where they kind of grab your skin and pull it up a little bit, and it should come right back. If it's loose, then there's some problems that they need to look at. So we've got skin and or breast. Eyes, conjunctiva are clear, no pallor, sclera intact, EOMI intact. For the 95 guidelines, EOM intact. EOM is extraocular muscles, which are the 6 muscles, I believe, that control your eye. Those under the 97 guidelines, you'll see are actually part of the neurological exam, not part of the eyes. Mouth is obviously ear, nose, mouth, throat. Teeth is also part of mouth. Pharynx is the throat. Neck. Neck is a body area. There's really no way around that. They're not checking anything, for range of motion or anything musculoskeletal. Normal rate and rhythm, no murmur, normal first and second heart rate sounds. That's all cardiovascular. Lungs, clear to auscultation. That's organ system. Abdomen. Okay, now this could go either way. Let's just say we read abdomen. We have to make a decision whether this is going to be a body area or whether it's going to be an organ system. Bowel sounds normal. Immediately that clues me in that it's an organ system. Bowel sounds are the way that they listen to the gastrointestinal tract. So they're actually looking at the organ. They're not looking just at the area at that part of the body, if that helps at all. Okay, back. Okay, we have to discover if this is a musculoskeletal or whether this is a body area. Now he says spine normal. As soon as he checks the spine, we're looking at musculoskeletal because we're looking at the skeletal structure of the human being. So let me say that that's musculoskeletal. Typically I'm doing highlighting them because I'm on a computer, and I tried doing circulars in an earlier version of this video, and it just really did not turn out well. So typically if I'm evaluating these using this tool, I'll circle them, or I'll just put a check mark right about here, so that way there's an obvious reference to it without it interfering with the review of systems. Extremities is always a body area. And then psychiatric. Okay, so now we've discovered our organ systems and our body areas. Now what we need to do is find the level. I think what you'll see here is that it's very obvious why the 95 is not favored by Medicare. Okay, so we'll go with the first possibility is problem focused. You can have one organ system and or body area. We have more than that, so we're going to go up to the next level. Expanded problem focused is, according to this chart, 2 to 4 body areas and or organ systems. I have more than that. Detailed is 5 to 7 body systems and or organ areas. Organ systems, I have more than that. And comprehensive is 8 or more organ systems only. You cannot use body areas when trying to look for a comprehensive exam in 95 guidelines. So I've got 1, 2, 3, 4, 5, 6, 7, 8, 9 body or organ systems is what I have. And so this would actually be, according to the 95 guidelines, comprehensive. Now, let's for a little bit go back to detailed and expanded problem focused. In the textbook that I recommended that you guys have, and in our earlier textbook, it said that an expanded problem focused is 2 to 7 body systems and or organ systems and or body areas limited, and detailed was 2 to 7 organ systems and or body areas expanded. The problem is that there is no definition of what limited means and what expanded means. It's generally conceded that expanded means more detail than limited, and that limited is usually a very brief description, 3-4 words. But again, that's just a general impression from the literature that you read or from personal experience. There is a rule out there that some people use called the 4x4 rule. I'm not going to test on that because I think if we add too much, it'll just be overwhelming. But be aware of it. I can find more stuff on it if you guys want, just as an FYI. Just let me know and I'll snag an article that I have at work and set it up and send it out. So the only thing that's really crystal clear here is the problem focused on the comprehensive. Even with the way that I have it, sometimes there are scenarios where I've got 5 organ systems, but they're really skimpy descriptions, and so it technically is a detailed exam, but it feels like an expanded problem focused exam, and so usually you leave it as expanded problem focused. So that's kind of the difficulty with the 95 exam is that it leaves, in particular, the expanded problem focused and the detailed extremely wide open for interpretation. For the purposes of assignments, I think it'll be a little bit more clear cut, but when you get out into professional practice, it can kind of be confusing, and it can kind of throw you off guard because it feels like an expanded problem focus, but technically it's detailed, and sometimes you go with your gut rather than what it technically is. So let's go back up here a little bit, and we're going to go through the 97 guidelines. The 97 guidelines are this blue area right down through here. Now, so far what we've looked at, like with review of systems, we said, okay, no fever, no chills. It's 2 aspects, but 1 system. In past medical history, we look at meds and allergies, but it's 1 point for past medical. Even with the 95 guidelines, we look at aspects of, bowel sounds normal, no masses, hernias, organomegaly, and those are aspects, but it's 1 system. With the 97 guidelines, we actually look at the specific tests that are done in the system, and then we apply them. We don't really look for the system except for the comprehensive, which I'll go over in a little bit. So I'm going to go through these things again and highlight some known issues, in particular with physicians, because they may try to argue it with you. So the first thing that we have is we have vitals. Vitals are the first thing that's listed here. It doesn't say it here because it's generally understood, but you do have to have 3 or more vital signs in order for it to count. General appearance we have. That can be no acute distress is usually the way it comes up. You'll see also well-dressed, well-nourished. Sometimes you'll see WDWN. It's well-dressed, well-nourished, or NAD is no acute distress. So we've got general appearance. Skin. Skin is moved a little bit more just to make room. Inspection is the no rash or prominent lesions. Okay, palpation is any time that you touch the skin. There's 2 ways you'll see that. You'll see good turgor, which is technically palpation of the skin. Well, it is palpation of the skin. And then there's also warm and dry. Either one of those will qualify as palpation of the skin, or any synonym that goes along with them. For the most part, you'll see it here. It's kind of the benefit of an EMR. Eyes, conjunctiva clear, no conjunctival pallor. We're talking about the conjunctivae and lids. Okay, EOM intact. Now, EOM is, like I said, the extraocular muscles. It's a cranial nerve. I don't remember which one, so I'm actually going to give this physician credit for cranial nerves. Okay, because there's just nothing in eyes that we can use for that. Let's see, pupils, irises. Pearl stands for pupils equal and round. Pupils equally round and reactive to light. They're just watching for the dilation of your eyes at kind of a very high level. Optic discs and posterior segment. So they're kind of looking looking through your iris into the back of your eyeball. Okay, external ears and nose. They'll say usually no ears or no lesions on the ears, or external nose normal. EAC is external auditory canal. TM is tympanic membrane. Usually you'll see those abbreviations and they'll be normal. Hearing is normal conversational hearing. Nasal mucosa, septum, and turbinates. Obviously when they're looking up through the nose. Dentition, which I have right here. Notice that there is nothing here for the mouth, for the mucous membranes in the mouth. So sometimes we just have to throw it off. Dentition can be anything about teeth or gums or the tongue. Any one of those is good. Pharynx is the oropharynx. So we've got oropharynx. Okay, neck, they've palpated it. Supple without lesions. Supple basically means without any masses or kind of sticky skin. Thyroid, non-enlarged, non-tender. So we've got neck and thyroid. Okay, heart, normal rate and rhythm, no murmur, first and sound, so that's auscultation of heart. Just as an FYI, on the key assignment I actually have these spelled out, so for the most part you don't have to worry about abbreviations. Lungs, clear auscultation, normal respiratory effort. We've got auscultation, respiratory effort, abdomen, bowel sounds normal. There is no bullet. They call these aspects bullets. You'll hear that term thrown around a lot. And it is on the assignment. That's kind of how I prefer them to be called, just because that's the accepted terminology. There is no bullet for bowel sounds. That throws a lot of physicians because bowel sounds are used a lot in diagnostic effort. So keep that in mind. No tenderness, no masses, no organomegaly, and no hernia. Kind of trying to skip through these pretty quick. So, because obviously there's a lot. No masses, tender, no organomegaly. Remember, that's the liver and the spleen. They've checked both of them. It's kind of a medical shortcut for saying that they've checked those two. There's no abnormal enlargement of the organs. No hernias. Back. Spine normal without deformity or tenderness. No CVA tenderness. There's no bullet for CVA tenderness. Just kind of throw that out there right now. But it's medically appropriate to document it. That and bowel sounds, even though there's no bullet for it. Be careful when you talk with physicians or train them. I did have one physician that I taught who's a good friend of mine, but when we sat down and went over this and she kind of got that feel for it, as you'll see in the next couple of weeks, the exam actually doesn't normally drive the code for established patients, and she stopped documenting her exams. Please make sure that your physicians follow good quality documentation. They should have something written on there. And the reason is because otherwise they don't know, their colleagues don't know what the physicians saw when they saw the patient from a medical point of view. Okay, so the back though, it says that spine's normal, so he has inspected the spine. I'm just going to put an X there. Each one of these squares is a potential bullet. Okay, extremities, no cyanosis, that's inspection of skin, in case they didn't have it before. Edema and varicosities are up in cardiovascular. Something that you might run across in the assignment, I don't remember, is peripheral pulses. If I see peripheral pulses, I give credit for femoral arteries or pedal pulses, not both. One or the other is fine. And psychiatric, mood and affect, judgment and insight. Judgment and insight, and mood and affect. Okay, so I've got 3, 5, 10, 12, 15, 19, 20 bullets. So now I go up here to the grid for the 97, and I've got my 4 possibilities. We're going to go through the first 3 real quickly. It's pretty obvious. You just count the bullets, and however many bullets you have, that's what level it is. That's what makes 97 preferred. It's very clear cut. There is no ambiguity because it doesn't matter whether it's limited or extended. If it counts for a bullet, that's the bullet that you got. So we've got 20, so it's definitely not less than 6, definitely not 6 to 11, it's greater than 11. Why do I say it's not that 2 and 9? Because you would think, well, that's 18. Well, it's not written as 18 for a very specific purpose. 2 and 9 means that you need to have 2 bullets in 9 systems. So follow me on this. I have my bullets, and you'll notice right next to them is a system. So real quickly, we're just going to go through and we're going to count the systems that have at least 2 bullets in them. Constitutional, eyes only has 1 bullet. Ear, nose, and throat has 2. Neck has 2, as does respiratory and cardio. Oops. And GI, skin, and psych. Now, notice that I did not do musculoskeletal, which is a little side note. Don't forget these 2 little bullets down here. They go with this grid for the musculoskeletal system. That's why it says musculoskeletal continued. And I didn't highlight I because they only have 1 bullet. I mean, you need at least 2 bullets. So now I count the systems. I got 1, 2, 3, 4, 5, 6, 7, 8. I'm actually 1 system short. So this would actually be 8 or more organ systems, for the 95 guidelines, I failed this 2 and 9 criteria, so it makes this detailed. I'm going to make sure very clearly that you understand that if you don't meet that 2 and 9 criteria, it is a detailed exam, or an expanded problem focused, depending on, or a problem focused, one of the other three, depending on how many bullets you have. But usually you can't get it without the 18. Okay? Now, you look kind of at the level of this exam, you say, well, the 95 is higher, so we could take the 95. That's possible. We could do that. This has a detailed HPI. There's not much benefit if we take the comprehensive exam, though. Now, it is medically appropriate, because if I recall right, this patient's suffering from dizziness, dysuria, a whole bunch of other complaints that kind of suggest something sinister. If I recall, it's not, but it's kind of the thought at the time, which is why we have such an extended exam. Sometimes if you look at an exam, there maybe have something that you may have to throw out. For the purposes of this assignment, there's nothing that's thrown out, but be aware, be cognizant of that you may have to do that in the future. Some things that I want to go over that are kind of some gotchas. Remember, for the 95 guidelines for neurological in particular, we had gait and station. We said that counted as neurological. Cranial nerves, reflexes, sensation, orientation. In the 97, it's kind of sprinkled out. Okay, so cranial nerves, reflexes, sensation. DTRs, by the way, stands for deep tendon reflexes. It's kind of when they hit your knee with the hammer, the reflex hammer. But notice orientation in 97 is under psych. Gait and station is under musculoskeletal. This may throw a physician off. You need to be aware of the two differences as well. But just like I said, be aware that in the 97 guidelines, things are organized a little bit differently than they are for the 95. The 95 is basically whatever the physician says is in that system. Whereas the 97, that's predefined for us. The other big gotcha is the lymphatic system. Because notice that for the lymphatic system, the first thing that it says is, hey, 2 or more. Okay, it doesn't mean checking 2 nodes. It means checking 2 lymphatic regions. The neck is considered from the clavicle and above. The axilla is from the waist to the clavicle. The groin is from the waist down to the bottom of the pelvis. And then other is the extremities. If they just check for lymphadenopathy in the cervical region, there are no bullets. Even though they did it, even though there's a space for it, there are no bullets, because you have to have at least 2 or more. I think the justification for this is that in order to, in a normal exam, they're always checking lymphadenopathy in the neck. It's just part of what they do almost every exam. So I think they're trying to give credit for the lymphatics for when there is a genuine lymphatic concern. If you guys have any questions, feel free to post them in the forum. I would prefer that you do that, so that way everybody can benefit from the answer. If you answer another student's question, I don't mind that. Just keep in mind that I reserve the right to kind of make corrections and pay attention to what I say for obvious reasons. One, it's going to be on the exam from my perspective, and also just professional experience. I need to make sure everybody has the correct answer, or the most correct answer. Alright, so that's it for this exam, or for this video on exams, and next time we do a video, we'll do medical decision making, which is kind of a mixed bag. Some people find it complicated, some people say it's really easy. But we'll see you next time.